And yeah, as she said, facilitating the Q&A at the end, and Lauren's coordinated all these webinar series. So this session forms part of a wider series of events that are taking place this week. The public health team at Birmingham City Council have organised a series of webinars explaining the toolbox, and each session will cover a measure and a toolkit, and that forms part of the toolbox. And the sessions are open for everyone, especially those working on developing interventions for future bids. So as an introduction, impact and outcome measurement should be a key part of any intervention. Measuring the impact of what we do helps us demonstrate that what we are doing is making a difference. They help us demonstrate that an intervention is having an impact in a measurable way rather than using just stories. Using standard tools allows us to compare different interventions' impact, and combining these standard measures with standard questions on people's identity helps understand if different interventions are more effective for different groups. We can also combine them with information on the cost of an intervention and the number of users to look at the cost effectiveness of the intervention. So without clear impact and outcome measurement, it's difficult to support funding for interventions or to justify that the approach used should be continued or scaled up. So the Birmingham Public Health Measurement Toolbox has been developed to standardise impact and outcome measures for interventions that are trying to improve health and wellbeing across Birmingham. The Toolbox supports organisations when they're developing projects to build the appropriate measures into their service design. It provides clarity and transparency on how to clearly assess and measure interventions based on their focus, which can then be demonstrated clearly when applying for funding. It allows for accurate and meaningful comparison between different programmes and interventions to help inform decision-making. So then just about the Birmingham Public Health Measurement Toolbox. The Toolbox is developing a set of resources to support measurement related to different areas of health and wellbeing. These include, and then we have a variety of events on this week that will go through physical activity, mental wellbeing, blood pressure, LARC, so long-acting reversible contraception, and HIV and hepatitis risk reduction. And then for each section, so even today, specifically for smoking, there's going to be a description of the issue, links for local or national information and data, a description of the tool, and then information on any registration requirements to use the tool, as well as useful links to support behaviour change and evidence-based interventions. And then we'll go through a case study at the end using the toolkit. So now specifically onto the smoking toolkit. So just for a bit of context, a bit of background. So tobacco use is one of the most significant causes of health inequalities, and there's a strong link between cigarette smoke and socio-economic groups. Smoking has been identified as the single biggest cause of inequality in death rates between rich and poor in the UK, and accounts for over half of the difference in risk of premature death between social classes. Every year, approximately 78,000 people die in the UK from smoking, with many more living with debilitating smoking-related illnesses. Smoking increases your risk of developing more serious health conditions. Some may be fatal and others can cause irreversible long-term damage to your health. So it's never too late to quit smoking, and with the right support, you're 3 times more likely to quit for good. Onto the national and local context. So at the bottom here, we have the OHID, so the fingertips tobacco control profiles. I think at the end, we'll put the link in the chat box, as well as the National Centre for Smoking Cessation and Training. So that's the NCSCT. It provides free training, such as practitioner training, very brief advice, stop smoking support, at specific target groups, homelessness, pregnant women. It's a really good resource to utilise. So as we mentioned in the previous slide, smoking is one of the biggest drivers of disease and premature death, and it harms nearly every organ in the body. reduces fertility, and significantly raises the risk of developing type 2 diabetes, eye disease, and dementia. It leads to decreased bone mineral density and is associated with increased risk of osteoporosis, bone fractures, back pain, and degenerative disc disease. Supporting people to give up tobacco, whether cigarettes or other forms, should be based on behaviour change theory and practice. So then in terms of measuring smoking, so the target population specified in this smoking toolkit is adult smokers living in Birmingham or registered with a GP in Birmingham, and then covering either unemployed, working in a manual occupation, e.g. a factory worker, or who have a long-term mental health condition. In terms of the measurement tool and frequency, so we'll get onto the actual tools of the questionnaire itself in a couple of slides, but it's about introducing that pre-intervention, so before the intervention's even started, mid-intervention, just kind of as a check-in to see how it's going, and then 10 weeks post-intervention. So what are we aiming to measure using the tool? So we want to have better understanding of barriers that individuals experience when trying to quit smoking, citizens' awareness of the existing stop smoking services available to them, and then uptake of service and signposting to stop smoking support interventions. We want to know if individuals are aware of the available stop smoking services. Do they know if they're eligible to access these services, and what type of tobacco they use and frequency? So this is the tool itself, so the questionnaire. So there are 4 questions and there are different response options for each question, and it's a case of ticking what's applicable. So we have what's your smoking status, so we've got the current smoker, cigarettes and pipes, current smoker, vapes, e-cigs only, current smoker, shisha, ex-smoker, and then never smoked. And then if you're a current smoker, how many cigarettes, pipes, vapes do you smoke on average each day? So that's free text response, just because of the variety of answers you could get. And then do you regularly use the following? And then so we've got the cat, pan, betel nut. And then do you want to stop smoking? Yes, no, not applicable. So then using the tool, so we've got the link there to make every contact count, and then which also then goes on to list further resources, so the very brief advice training, and then in terms of being in the community, so as someone that's able to engage with members of the public, it's kind of the encouragement with the very brief advice to anyone that potentially could be a service user of the intervention, and asking the questionnaires in the toolkit. And then we have ensuring appropriate policies are in place to collect and store the data, as well as establishing any IT or language issues that could come up along the way. So specific risk and issues to consider. So Birmingham is the second most diverse city in the UK. It's about exploring kind of the need for translation, the language and communication barriers as part of the intervention. And then also we've got listed digital poverty. So not everyone has access to the internet, uses the internet, or has digital skills. So it's just things that need to be considered when thinking of the intervention to utilise the toolkit. So then on to the case study. So this is just showing the timeline of a case study. So a target group, so a group of people that fit the kind of the target requirements. So that could be adults that are employed in manual occupations. So a specific group or site or location has been identified. Where smoking prevalence is high. It's a case of approaching the individuals and identifying the barriers and issues using the toolkit. and then going on to actually have the review, the mid-intervention check-in as such, applying the questions again, and reinforcing the intervention that's taken place, and then 10 weeks post the intervention, asking the same questions again, and just ensuring that you're recording the response. Then here we've got a list of additional resources. So that's the NCSCT again, as well as what services are available from the NHS, and then the NICE guidelines as well. And then we've also added here, we most recently did, as part of the Bolder Healthier Winter campaign, a webinar on respiratory health and smoking. And then that's it.